let's embark on the second part of our discussion of psychosocial interventions in functional recovery in schizophrenia, realizing opportunities today. In the first part, we explored what the drivers of functional impairment in persons with schizophrenia are, and we examined how effective different psychosocial treatments, psychotherapy, social supports, etc., can be in terms of addressing, targeting these drivers of functional impairment. In the second part, we will examine effective application of what we have available, even as each of these psychosocial treatments need additional refinements. They are effective. They're evidence-based. They're effective in targeting different aspects of the condition, targeting different drivers of functional impairment in persons with schizophrenia. And we will discuss how to apply them, how to implement these strategies most effectively for the care of each individual patient, and really discuss how we address this in a manner which basically optimizes their function for each individual. And so we have the framework, and we know there are challenges in terms of applying these interventions. Partly, we might not be aware of how effective these interventions are, or there might be barriers in terms of implementing them in one's clinical setting. The first thing is, of course, recognizing we've got a problem, that there is significant functional impairment in our persons with schizophrenia, in the persons we treat for schizophrenia. There are barriers to their leading fully productive, meaningful lives, and that we do have a range of psychosocial interventions, specifically in our discussion, that can help address that and optimize functional recovery in our patients. So we need to be aware of that. And then we need to know how to utilize those treatments more effectively for each one of our patients. And we'll keep returning to this. There's need for individualized care, measurement-based care, iterative care that you come back to and see what you're doing and its effects. Is it working? Is it not working? If it's not working, how does one modify, change that? And as with anything else, it starts with assessing what the drivers of functional impairment are in the patient with schizophrenia sitting in front of you. Assess what the drivers are in this individual, intrinsic drivers, intrinsic to the condition, different symptoms. And we know that different persons with schizophrenia have different degrees of different symptoms, positive symptoms, negative symptoms, cognitive deficits, mood symptoms, etc. And so in this particular individual, what are the intrinsic drivers of limiting functional function in these individuals? What are the behavioral drivers in this person? What are the comorbid conditions? What are the consequential drivers? What are the societal contextual drivers in this individual patient in terms of driving functional impairment? So what are the drivers of functional impairment in this individual? Then think about what the downsides, what the treatment burden of any treatments that one is providing to this individual might be contributing, that might, in addition to the disease burden, be limiting function. Then one evaluates function. When we talk about impaired function, it's important to quantify and really define that in this particular individual. So one needs to evaluate functioning across domains. And as we all know, that we don't function, none of us function exactly at the same level across all domains of function. And there's variation. In this person, how is this person functioning across different domains of function? Each individual patient, it's their lives. It's not our lives as clinicians. It's their lives. And what are their priorities? And as we know, that different individuals, different people have different priorities in life. So what are their priorities? And then develop a plan with them to address these drivers of functional impairment and optimize their functioning, their ability to lead meaningful, productive lives. Now, it's important to recognize that while we're good clinicians, our clinical judgment, broad clinical judgment has value, we also have very useful tools, well validated tools, and relatively straightforward to use tools that can help us in terms of assessing both function as also drivers of functional impairment. And so it's useful to use these quantitative measures, these validated tools, to kind of assess what the drivers of functional impairment are, and then to assess the impact or whatever it is that we might do to reduce these drivers, to address these drivers, target these drivers, and thereby improve function. Of is it making a difference in this person? Once we're done with the assessment, this individualized assessment, looking at the broad context of what is driving impairment, what are the drivers of functional impairment in this individual in this setting, we develop an individualized treatment plan. And then we think about which psychosocial interventions might be most appropriate in the context of the functional drivers in this individual. We need to examine available resources, which may not be comprehensive, but we need to utilize the resources we have, even as we seek to enhance resources, provide a broader array of services that can better match the individual's needs, but utilize the available resources to target the specific drivers of functional impairment in this individual. And really, again, want to emphasize that pharmacotherapy is foundational treatment, and we need to optimize pharmacotherapy and integrate the psychosocial treatments for this individual with optimal pharmacotherapy. And again, with regards to both pharmacotherapy and psychosocial treatment, measurement-based, individualized, targeted treatment, and recognize that we don't have to think about just a singular psychosocial intervention. We can combine different treatment modalities as appropriate, because they can have additive synergistic value in terms of addressing these drivers and thereby enhancing functional recovery. And then once we've developed a treatment plan, we also need to think about a longitudinal monitoring plan. So how are we going to assess the impact of what we're providing this individual, or what we're working with this individual on? Are these interventions effective? Are there downsides to them? Are they really addressing the drivers? Are they really enhancing function? And again, we have tools to assess function, and we need to utilize those tools. And again, it's important to examine what is happening to the drivers of functional impairment, i.e., symptoms, etc., and also examine function, because they're on two sides of the ledger, of, if you will, of the framework that we discussed earlier, with the interventions in the middle. So are they effectively addressing the drivers that we hope they're targeting? And are they also enhancing function? And then, there are broader societal contextual things that we need to examine well, but we need a monitoring strategy and then monitor. And once we think about the context in which we have planned a treatment plan for this individual, then what are the barriers? We don't have trained CBT professionals, for example, or we don't have an infrastructure to provide this. There are reimbursement gaps. And so, again, we need to address them at a broader level, but it's also important to recognize there are some things that we can do now without enhancing any of these other needs, if you will, addressing any of these needs. Yes, we need to kind of have a broader array of services that's available, a fuller cadre of trained professionals. But there are certain things that we do that we can improve that might be helpful in terms of enhancing function, improving function in persons with schizophrenia. When I came into the field uh, 45 years ago, there was a sense that, schizophrenia, unfortunately, if you have schizophrenia, you're not going to function well. The meaning of schizophrenia is poor function, if you will. It's important to recognize that is just not true. There are varying degrees of recovery that I have experienced in the several thousands of patients with schizophrenia that I have treated over the last 45 years. So the first thing is a belief that varying degrees of recovery are possible, and there are a number of things that we can do to promote recovery, to enhance the ability of persons with schizophrenia to lead more productive, meaningful lives. We may not be aware of all the tools that are available, and hopefully, this publication, in which we review the different tools and details of these tools in terms of which functional deficits they target and how to apply them, might be helpful. So it's important to think about how to apply these tools in this individual setting and utilize the tools that you have in your community. The different communities, different settings of care are in different contexts. Is supportive employment available? Is supported education available? And are there opportunities for that? How about supported housing? So even as we seek to improve access to all these different tools that might be helpful, that we know to be helpful, uh, there are varying degrees of these tools already available in your particular setting. And it's important to be aware of those and utilize them, harness them most effectively. And then, based on what is working, what is not working, adjust care, modify treatments, take something that you are providing that's not working or maybe associated with some downsides away, add something else, and keep monitoring the impact of what one is doing over time. So with that, it's important to be aware of the changing environment. We all marvel and wonder about artificial intelligence and different tools associated with it. Can they help? And absolutely, digital therapeutics are emerging that basically can address a number of these barriers. And in fact, we have some tools that are available today, FDA approved tools that are available today that can help improve access to different kinds of interventions. And so it's important to be aware of the changing environment, the changing tools that are emerging, and utilize them more effectively. And they can really help us augment what we're doing in our individual clinical practices to enhance the lives of persons with schizophrenia. So, in summary, again, optimized pharmacotherapy is the foundation in terms of helping persons with schizophrenia lead more productive, meaningful lives. And we know that in terms of what the outcomes today, there is a long way to go. We need to improve what we're doing collectively. And a part of that has to do with our not non-application of a whole range of psychosocial interventions that are evidence-based, that are shown to both address the drivers of functional impairment in persons with schizophrenia, as also actually improve function. And in terms of what we can do, awareness of these tools, awareness of how to assess drivers of functional impairment in persons with schizophrenia, and then be aware of which tools, psychosocial tools, target what drivers of functional impairment and what's available in our one setting and how to apply them to enhance this individual's function. Recognize that we have a whole bunch of tools, assessment tools that we should utilize, to complement our broader global assessment, if you will. Digital therapeutics is is something that, we should be more aware of. A number of tools emerging, and uh, applying them to the care, making them available to our patients, I think is an important thing. Again, targeted measurement-based integrated care in terms of optimizing the lives, helping individuals with schizophrenia lead lives of maximal productivity and meaning. And we need to be realistic. So it's not as though we're going to be fixing all the problems. The psychosocial tools that we have, the interventions we have, need to be further refined so that we can apply them more effectively. But I think we can do better collectively to help persons with schizophrenia lead more meaningful lives. I want to thank you all for your attention, and thank you for your efforts in improving the lives of each one of your patients, and enabling, facilitating recovery and working towards recovery in each one of your patients with schizophrenia. I would, again, uh, encourage you to take a look at the document, Psychosocial Interventions in Functional Recovery in Schizophrenia, Realizing Opportunities Today, which comprehensively examines the issues that we have discussed. It's published in the Journal of Clinical Psychiatry. I'd like to draw that to your attention. And with that, thank you.